First thing is the name of the subject should be changed. It should be made Medical Pharmacology and Therapeutics.
Hello and welcome to another episode of DecodeMD, where we explore the stories, struggles, and successes behind the life in medicine. I'm your host, Dr. Pranav Joshi, and today we have with us a truly multidimensional leader, Professor Dr. Subhrojyoti Bhowmick, sir. A clinician turned clinical pharmacologist, a global researcher, a Stanford alumnus, a WHO patient safety fellow, a digital health consultant, and currently the vice president of project development and academic initiatives at KPC Medical College, Kolkata. His career spans decades, continents, and domains across academia, industry, research, quality, leadership, and whatnot. So, this is not just a career story, it's a masterclass in reinvention, adaptability, and purpose. So, let's begin. Welcome, sir. So, sir, let's start from the very beginning. When did the dream of becoming a doctor first take shape in your mind?
Okay, thank you, Pranav, for having me here today. I really congratulate you for this particular initiative. As far as our growing up is concerned, when we you grow up being a decent student, so I'm talking about like 30 years back. At that point of time, when you come from a background where you have studied science in 11, 12, then there were only two options: either you become engineer or you become a doctor. So I'm talking about the year 1997. And interestingly, I will say that it was not a great, I was not that, I'm not those kind who always wanted to be a doctor, to be very honest. I wanted to do something which was curious and inquisitive. I have a curious nature, so anything which was a bit off track in biology interested me. I was not very great in mathematics. I somehow appeared for the exam, cracked at that point of time our state medical entrance because, I won't say I was like a topper in those days, getting 95, 96%. I personally consider myself very mediocre, 80% kind of student. So, yeah, God is very kind, allowed me to get the entrance exam and had to go into Arjikar Medical College, which is still a very good college, was in news for very wrong reasons recently, but it is a 96-year-old medical college actually.
Yes, sir, we have all heard news about the Arjikar Medical College. It has been in news for sad reasons.
Very unfortunate, extremely unfortunate. And but then must tell you that it was set up by the Britishers. So it used to be called the Carmichael Medical College, and after Calcutta Medical College, this is one of the oldest medical colleges in the state of West Bengal and has undergrads, postgrads, as well as MCH, DM seats for so many years, and it is located in the north part of the city of Calcutta and has a illustrious history of training doctors and healthcare workers. It has a huge nursing college as well. So people trained here are not only in India, but a huge proportion of them work in the United States, UK, and Australia as well. So apart from in the Emirates, so a great legacy, a college with great legacy.
Yes, sir. Okay, sir, during your MBBS years at Arjikar Medical College, what were the biggest influences that shaped your approach to medicine?
Great teachers, I would say, great seniors. Some of the teachers who shaped it were both in so-called pre-para, but I think these are very, very important subjects. So I very fondly recollect my pharmacology HOD, Professor Shorkar, who actually used to bring toffees in the class. You'll not believe. And at the end of the class, she used to distribute these chocolates and toffees. Apart from that, in certain departments, like we had Professor Bhattacharya in microbiology, who actually made us understand that what cannot be seen is very powerful, including the God and microbes. I'll also take the name of Professor Shubhajan Ghosh in pediatrics. He was one of the people who actually taught me empathy because in pediatrics, the children, they require something more than medications is, I think, affection and love, which and requires a lot of patience, which I think in every branch of medicine is required. very fondly remember him. There were many other teachers, but these are few teachers who are on the top of my mind. There were many good seniors. I remember in the first month of my internal medicine, internship, I could not do a single gelco, a single line. I could not. I used to always do the double puncture. And I was frustrated कि मुझसे नहीं होगा अब शायद मुझसे कभी भी नहीं होगा I won't be able to do it but then I had very good seniors from the who were doing their house jobs and they said it's fine. You just try once and twice, but the third time you will do it because in many patients you might not get good veins. So they kept the belief, and I think second month onward, I can still when I'm not into full-fledged patient practice, but whenever it comes for giving intravenous injections, I have that confidence that I can still give it right now after so many years. So that's how the training has been. I also want to acknowledge the role of my labor room nursing head. She taught me how to conduct a normal delivery. So it was very interestingly not the gynecology faculty, but the labor room nurses. So I really acknowledge, and it made me understand that the nurses are not there to only take orders. They are actually, they are partners in healthcare because in any government medical college, yes, where lot of patients undergo labor, normal labor, and very less of them, critical one, are put up for surgeries. So, and the normal labors in our medical college, I can tell you, I did it in September, October. Very vividly remember in 2000, the year was 2003, and on every particular 12-hour duty, I used to have at least 35, 40 labors happening. So, with two or three interns, I'm talking about many years ago, there were not so many MBBS seats at that point of time, and also not that many MD gynae PGs. So, we used to manage the labor room with the help of the labor nursing head. And there have been nights where 10, 12 deliveries have been conducted by me only which gives, when I look back, it has holistically developed me as a person who understands that healthcare is not only about prevention or research, but also delivering at the ground level and how important are other people in the team. This is extremely important that training early on in my career actually helped me.
Yes, sir. Sir, I can totally relate with labor room nursing staff helping you in learning the normal delivery and stuff. And not just labor room nurses, in fact, nursing staff of ICU, MICU, they also play a very important role in all the doctors, I would say. And we too didn't have PG seats in our medical college. So interns used to look after all the deliveries and even casualty room and all. So we too have managed all these things, sir.
Right, right,
Okay,
right.
sir, was there any moment during MBBS where you questioned your choice or reconsidered your career path?
I am not a person who likes to quit, honestly. MBBS was very difficult, especially anatomy. I used to cry before anatomy exams, so many Latin words, and I used to think that I'm good at rattofying, but anatomy made me feel that it could be the father of all, rattofication. So when I look back, I was hardly a 17, 18-year-old person who went from school to the land of dead bodies, or where you actually go after post lunch and you start seeing the human body either as an upper extremity or a lower extremity or just as an abdomen. That kind of a mind shift is very, very, very difficult sometimes. And yes, during those first 6 months, I was actually questioning, is this doable? But then having come from middle class background and when your parents really want you to become doctors at the end of the day, and we are those generations who actually still were very connected to our parents, so we had to continue it. And luckily, I didn't think I really got bad marks. I actually missed my distinction by few marks in anatomy, but yeah, it was very scary. And forensic medicine, I remember the day when we went for post-mortem practical in one of the morgues by Kolkata police. Honestly, I was just praying that we don't need to do any more post-mortem, trust me, because that is something I have understood, that I probably like the human body when it's alive. I don't like the human body when it's dead. Yeah, that made me realize that yes, I cannot take up any branch of medicine which deals with dead tissues or dead body, whether it's pathology and related sciences or anatomy or forensic medicine. All of them are extremely important, but I was not cut out for them. So glad that the MBBS just got over.
Yes, sir. Sir, you spoke about the shift of mind from school to medical college. Similarly, during MBBS period, majority of students hope to get clinical branches in their PGs, but many of us obviously don't score well enough to get into clinical branch, so end up getting into non-clinical branches like MD Pharmacology. So
Mm-hmm.
that mind shift is also there. Like during PGs, as soon as they enter in the first year of their residency, they were expecting ki they will get patient interactions, and in MD pharmacology they have like zero patient interactions. So what was your reason to choose MD pharmacology?
Yeah, to be very honest, I wanted to give the PG exam once again. So I'm not going to be the cliched person who would say that, yes, this was my dream subject. No, it was not. I had given my first attempt and a very serious first attempt, and this is the rank which I was getting. I was also getting DMRD, but honestly, radio diagnosis is something I figured out. I only know black and white images. So I asked myself, can I live my life with this if I don't give the exam? And the answer was no, because I don't want to just look at white and black images and write. Yeah, money might be there, but even if you open an alcohol shop, you will make a lot of money, much more than what the doctors make. So yeah, with MD Pharma, I think one of the safety net was that I'm a person who's got a very curious nature. So I thought, okay, we can go to the pharma industry, at least look at R&D and and at least explore the world, look at what's happening. So that might not be a very bad option at the same point of time, because MD Pharma allows you a lot of time to study once again. So definitely much better than, taking up subjects which will make you go every day and study. So, but when I entered IPGMR, Institute of Postgraduate Medical Education Research, which is one of the largest medical colleges in Eastern India, it has close to 2,000 beds, and it had extraordinary faculty at that point of time. And right now also some of them exist. So I met my thesis guide, Professor Abhijit Hajra, who had got a rank of around 90 in the PG entrance when he gave his exams 11 years back. So all India 90, and he completed his MD pharmacology from St. JS KEM Hospital. So that was by choice. And then there were other people like Professor Mitali Chatterjee, who had at least few crores of grants from DBT and DST, and she was doing her research in leishmaniasis. And then there was Professor, that point of time she was Associate Professor, Shuparna Chatterjee, who plays a very important role nowadays in the PVPI program. She's one of the very important forces in India right now, a technical person in the PVPI. So when I went, then I saw that life with pharma is, there is a lot of clinical aspect in it, and there is a lot of applied aspect. There is a lot of genomic aspect. This was not known, and when mind doesn't know, the eyes cannot see. I slowly started learning about the subject, and then I thought, okay, why not make a career out of this? Because this has a reasonably decent work-life balance, and also I had a huge knack again because I always wanted to do medicine-related subjects. I was not a very surgical-oriented person, so this was a good option to take. And yeah, I will say the first year was not very motivational for me, but I never missed any chance to connect to people who had done pharmac and were either in the hospitals or in the industry, and that kind of a role modeling definitely helped. So here I am. I mean, after so many years, I mean, what, 2009 I passed out. It's been 16 years now. So yeah, doing reasonably okay.
Reasonably would be an understatement, sir. You have been in this MD pharmacology field for so many years now. You only said for it has been now 60, more than 16 years, I would say. So for future aspirants, what kind of mindset or skill set one must have to truly thrive in pharmacology?
I think one is you should not have ego. That is a very big problem. I will say what you should not have rather than what you have, You should not have a craving for stethoscope. If you have a craving for stethoscope, then this is not your field. You should not have a feeling that this is a paraclinical subject. If you have that mindset, then you are at a wrong place. Then that means definitely you are cut out for clinics. You also should have an mindset that this subject will, like any other subject, will change very, very rapidly. And you should be open to knowing clinical trials, because that is, I believe, it's forte of us. So you should know the art and science of clinical trials in the world, not only in India. That is something. And lastly, I would say, as everybody is saying, the domain of medicine and healthcare is drastically going to change over the next decade with the advent of artificial intelligence. So you must be aware of how AI functions and how it is changing the functionality as far as pharmaceutical industry and drug development and research and pharmacotherapeutics is concerned, because you are going to be the subject matter expert in 10 years time, because if you don't take up that space, then somebody else will take it up. So that's very important, extremely important.
Rightly said, sir. With the advancements in AI and technology, I too feel MD Pharmacology has the potential to become a subject that would drive entire medical faculty.
Yeah, I completely, and it's going to be a big disruptor, because so-called traditional branches are going to not retain how they function, because honestly, before COVID-19, nobody would have thought the world will sit in front of a camera and do consulting. So, 2019 actually was a watershed mark where it has shown that even if you don't visit your doctors, you can still survive. A huge debatable issue, but so people are saying that technology will not replace anything, but technology will definitely replace the way hospitals function nowadays, or the healthcare industry is functioning. And it's a matter of time, maybe it's not, if not in 2030, in 2035, or maybe 2040. I mean, all of us hope we live that longer. So we will have to embrace technology and accept it and move on. So this is a very important aspect which the juniors must be aware of.
Exactly, sir. Sir, after MD, your early roles covered clinical pharmacology, NABH, quality management, and pharmacovigilance. Right. So, how did you navigate so many domains so early?
I told I'm a wandering soul. I don't get happy. I get irritated when I'm actually at a place where things are happening at its own pace. So that's the reason I could not ever do a government job. I qualified for the government job in Bengal, but I understood that I don't want a so-called job which people say is a very, very established and a
Bill.
job which has its stability and it has its own role cut out. So I joined Pfizer immediately after passing out, and then in 1.5 years, one of the KOLs or the key opinion leaders. So I was with the medical and research division, managing 8 states in eastern India, based out of Kolkata. So one of them actually asked me that they were opening up a hospital in Calcutta, which was Medica Synergy Hospital, and was a 400 bedded hospital, and now it's been taken up by Manipal. It's been actually bought by Manipal last year. So he actually inquired that Shubhro, he's a big name in critical care now. Dr. Arindamkar, he is now hospital in Mumbai. So he kind of liked me, and he said that, why don't you come and join us in किसी बोल बे? He wanted to actually have they wanted to have a clinical research, clinical trial division, and they also wanted ethics committee to be there. They wanted a person to take rounds with the critical care team. So something, I'm talking about the year 2010, when it was not heard of, I mean, frankly speaking. Now you have a long question on the role of clinical pharmacologist in hospital. I actually remember that thing I did when he asked me to actually function that way. In fact, when I went, they asked me, what will you do? So I actually read a paper in the BJCP, which was the role of clinical pharmacologist in British hospitals. So I actually told them we are going to do this, and he said, okay, come on board. So I left Pfizer, but Pfizer did not leave me completely. So I was still a consultant for medical information for them. So I did medical information consulting for 7 long years, even after coming out of Pfizer. So basically, I used to do two jobs at that point of time. So in the morning, I used to go to the hospital, and evening, 7 o'clock, when I came back after freshening up and all, 3 hours I used to sit with the laptop. So medical information is basically, looking at queries which is generated by the field force regarding their products. And Pfizer had a team in Hyderabad which was generating responses to that, but they had to be done as per their SOPs. So they had to make science along with, so it cannot be commercial in nature. So completely scientific response had to go out. So it was very tedious to review. It was to review these responses in a day. It could be 40, 50 responses which you had to review, because there were like 100 products which were marketed by Pfizer at that point of time. Yeah, from 2010, 11, 12, 13, continuously till 2017, I actually did this for Pfizer. But only thing is, in 2013, the global medical information took care of some of the products. Some moved away from it, but 3 long years it was 100 products for Pfizer. Yeah, it was difficult, but yeah, as I told you, it gave me a lot of kick to be at the hospital as well as have one foot in the industry as well. So, yeah, managed it somehow.
Sir, even today, clinical pharmacologists are not very widely accepted. Like their roles are limited to only major hospitals or corporate hospitals.
So what are you asking in terms of they're not accepted where? In the hospitals?
Nahi, as in clinical pharmacologist role is not widely present in all the hospitals across India. They are only present
It,
in major corporate hospitals, right?
yeah, so that is, as it is a problem, it's an opportunity also, Let's not look it as a problem. We should look it as an opportunity because the reason why they are not there is because number one, I personally believe is many of the medical pharmacologists, I would like to call them medical pharmacologists, are not ready to take the risk to come to private and set up and work in a domain. Because see, we all, including myself, sometimes we love to be in a comfort zone. We don't want to go out of a comfort zone. Teaching is a big comfort zone. We know that we will be in a department which will have other people working like us. We like to relate with them. We like to take our lessons, I mean, lectures, do research, and sometimes do the emergency duty, full stop. But when you're mentioning about these private hospitals, many of them require it. So Apollo Group requires it. The people who are doing JCI, Joint Commission, mandatorily they require it. Some of the NABH hospitals require it. NABH this time has put one rider that the hospitals require a medication safety officer. So I put it this way that if you're a cardiothoracic surgeon, then yes, hospitals require a cardiothoracic surgeon, but the cardiothoracic surgeon should also be open to discuss it with the owners that if they have a small OT, then what cardiothoracic surgery can bring about. So I personally think that it is a two-way traffic and there are takers. India is a huge country. If not in your state, there'll be taker in other state for sure. So I am being very positive that wherever I have gone and whatever I have seen is good medical pharmacologists are always in demand, always in, and I can tell you in the private hospital industry. Yes, the role might be limited, but then you will have to evolve and engage with the stakeholders to make you more relevant because they have not seen this. Please remember the clinicians who are working right now have not seen their counterparts in the pharmacology department to come and work with them when they were training in the government medical colleges.
Okay, moving on. You have managed medical writing teams, drug safety, oncology portfolios, and even scientific communication, right? So, what were the key lessons you learned during your years in at Pfizer while managing all these things?
No, I think time is money is the most important thing. That is a very, very important thing which the pharma industry runs on. We cannot delay projects. Timelines are important, milestones are important, and to work according to regulatory
Yes.
guidelines because regulatory norms is extremely
Yes.
important. You cannot do any unethical work is extremely important, which I learned.
Okay, and sir, you have also led hospital quality and clinical research units at like Peerless and Medica. So,
Yeah.
how did you develop yourself as an administrative leader there?
So I was asked by the leadership team that, whether I'll be interested to learn about the NABH quality accreditation because I was heading the clinical pharmacology team. And they said, and as I told you, I'm a person who loves to learn new things and explore new things. So I got trained on the NABH quality parameters and I was fascinated to see how this develops. So over a period of time that the hospital gave me a lot of trainings. I was sent for national trainings and under my leadership, I was a management representative at these two institutions, the NABH coordinator. We achieved the NABH accreditation program and it gave me a holistic view of both the clinical and non-clinical functioning of the hospital. So I really enjoyed it. I still enjoy it, I would say that. And I think every medical pharmacologist should actually learn this should get if they get an experience they must take it up because how hospitals function is a very important aspect which we must know and the drugs and pharmacy and therapeutics committee the formulary development the antimicrobial stewardship program the medication error mitigation programs PVPI, pharmacovigilance program. So we have a very big role to play in that. So apart from this, I'm just mentioning about which is very core basics. Apart from that, there are clinical audits which needs to be conducted. There are various kinds of, various code red, code blue, all those kinds of emergency scenarios, how you can help. So it's a very, very interesting and gives you an extra knowledge of the functioning of the healthcare industry.
सर ये जो हॉस्पिटल्स में जो क्लिनिकल फार्माकोलॉजी का रोल रहता है उसमें व्हाट what kind of team do you have? Is there just one MD pharmacology who is heading the team, or do you have another extra MD pharmacology graduates who are working under your team?
So usually the baseline work is done by the pharmacists. So they can be B Pharm pharmacist, M Pharm pharmacist, and you have a MD pharmacology who leads the team. Apart from that, the bigger hospitals like Apollo and all, they could be after a certain years of experience, you can be the senior most, and then you have junior MD pharmacology who are working with you.
Okay, sir. Sir, your time at Stanford University and at WHO in Geneva is remarkable. Like, how did these global experiences shape your understanding of healthcare?
Yeah, I was very fortunate to get experience. I think the time at both in Stanford and WHO headquarters in Geneva taught me that problems of healthcare are very universal. Whether they are the medication errors or it is doing research with multi-stakeholder people. In countries like US or Switzerland, the issues remain same just like India. So we need to have a very global mindset. But yes, when we are implementing strategies, it has to take care of the local stakeholder understanding. And yes, definitely it has helped me, especially my time in the US has helped me understand how technology has changed the work in, especially the hospitals are concerned. So remarkable functioning of the Institutional Ethics Committee, Electronic Institutional Ethics Committee, where I got exposure as early as 2015 because the Stanford Institutional Ethics Committee was totally electronic. I'm sure they still continue that. So, which was not heard of in India at that point of time. So, and now many of the Indian ethics committees have become electronic. So, technology is here to stay. Technology will be there. And as I mentioned, problems in healthcare are universal. We just need local solutions.
That is very true, sir. Sir, moving on, you have successfully worked across many functions: clinical research, data management, patient safety, medical affairs. How do you keep yourself continuously adaptable?
As I told you, I believe that as a pharmacologist, we are generalist. We are not specialist, So it is just like when you are in the Bollywood industry, an actor cannot say that I will only do action movies. I think as a generalist mindset should be wherever the pharmacology tributaries are, we will have to function in those domains, and that will give you happiness, and that is going to give you a feeling of content that yes, you can evolve. And I would say I will now add that for the last few years I am a professor also. So the teaching component I have also tried to do as much justice as possible. My students have won so recently one of my MBBS students, she has won in Netherlands. One of the papers she presented in the International Medical Students Conference, and our papers which one of the juniors, one of our student has recently authored on IoT and artificial intelligence use in medical library functioning for rare disease was presented in a conference very recently. So I would say that for me, it's been a holistic journey of exploring pharmacology until I live the last day of my life. I want to keep exploring this. Makes me happy, it makes me feel content.
Sir, you said कि MD pharmacology is a generalist branch. So, do you feel कि in future we should have specialization in those fields, or like
Absolutely.
there are also opinions कि we can have a specialization in like oncopharmacology,
Yeah,
cardiopharmacology, nepropharmacology, like that. Do you
yeah.
feel कि we should have specialization based on the systems, or like based on these separate branches, medical affairs, clinical research, like these?
I think first thing is the name of the subject should be changed. It should be made medical pharmacology and therapeutics. First thing is MD should be in medical pharmacology and therapeutics. MBBS
Yes,
subject
sir.
name should be changed in medical pharmacology and therapeutics because pharmacology is also taught by the pharmacist and they also have M.Pharm in pharmacology. So there is a huge crisis when it comes to identity. When somebody asks, "आप करते क्या हैं?" So MD Pharma, when you say like they say, okay, pharmacist. So I think that is a big problem. First thing is that पहले नाम बदलो MD को MD in medical pharmacology and therapeutics. I think DM should be specialty wise. DM should actually come as pediatric pharmacology. DM should be in onco pharmacology in certain specialties. DM should be there. Clinical pharmacology should be taught in the MD pharmacology program, which should be renamed as MD as medical pharmacology and therapeutics. And excuse me for saying this, I am a strong non-believer in doing animal experiments at the MD pharmacology level because that is to be done by the pharmacist. We need a clear-cut classification of why should I do a dog and a cat and a dog experiments are out, but why should I do a guinea pig? I rather would write a protocol as a long experiment in my MD exam. I should go and take the medication history and drug history of a patient in the medicine ward. That should be my long case and do a medical reconciliation discussion. So I request NMC and I also, using your platform, I should say that these animal experiments and all should be out. I know I am a teacher myself, but I believe that makes more relevance rather than having pediatric pharmacology. More relevance is required to teach medical pharmacology and therapeutics. Yes, second year send students like how you're doing DRG. Second years teaching the students should go to a pharma company to do medical affairs, pharmacovigilance, and they should mandatorily do two clinical trials in 3 years. They should be part of it as a sub investigator. So that will that will give them a holistic mindset.
Yes, sir. I'm sure many current residents would also agree that animal experiments should not be there
No,
in MD pharmacology.
see, way back in 2018, I have actually written one article which you can Google also, which is the evolving role of clinical pharmacologists in Indian accredited hospitals. It is published in JPP, Journal of Pharmacology and Pharmacotherapeutics, published by JIPMER, where I have clearly said that what is our role in the hospitals. So, if the junior residents are listening to this, please read that because many a times you are confused what you need to do. Yes, I think animal experiments, preclinical toxicology, okay, long question, short question is fine. But that is a job of a toxicologist. We are not getting trained as toxicologists. Why teach things which are not, or put it in exam, which we are not going to do for a single day after we pass out? That is what is my thought process. Total wastage of time. Absolutely wastage of time.
Yes, sir. I'll definitely give that a read. As a consultant for digital health programs at Makut, MAKUT, if I'm pronouncing it right, what excites you most about India's digital health evolution?
I think it's very very rapidly evolving. Digital health is here to stay. We need more trained people, and there is always an opportunity in pharmacotherapeutics. So these are in the next 10 years, I would say this is the most rapidly progressing field. So all our young residents must be aware of how digital health is evolving.
Even like अभी और startups का trend चल रहा है तो MD pharmacologists do have tremendous opportunities I feel in evolving health tech sector. They can start their own entrepreneurships as well.
They can, but I personally always believe that you must have some experience to understand how the ground level is functioning. So do your postgraduate training very, very seriously. Don't spoil time. This is what I've seen. Many of the students are not doing it very seriously and they expect a huge job to land up because you have a degree. I'm sorry, that doesn't happen in real world. You need to know your subject really, really thoroughly.
Sir, moving on, how did your formal training from Stanford, John Hopkins, and City shape your approach to research and ethics?
Very much, extremely important that ethics is not, optional, but it is a mandatory thing. It made me understand that there are very many bodies in the world which work with ethical issues. And as I mentioned, the role of the institutional ethics committee, institutional review board, how powerful is it? I got to know, especially during my exposure at Stanford, where I worked there, and that people, even the so-called quote unquote lay person, if they ask questions, even if the others have approved it, if their questions are not answered properly, the approval never used to be given. So that has helped me to function on many ethics committees in Calcutta. Actually, a chairman for four ethics committees in Calcutta, and I try to incorporate that during my functioning as a chairman.
Yes. Sir, you are now a professor and vice president for project development and academic initiatives at KPC. What does a typical day in your role look like?
Usually predictable, I would say. The first half is in the department, so I usually go to the department, sit with my PGs. I have my PGs, so look at what they're doing. When I have a class, I'll take my class. So I like taking practical classes, in the senses, connect with the undergrads. That's that kind of motivation I really like. And then second half, we have various projects which we are working on. We are building a university. We are building an onco hospital. So, and I sit with the quality team to look at the NABH accreditation program of my medical college hospital. Yeah, sometimes we are debating on certain other conferences which we are doing, and also looking at the patient satisfaction committees. I'm on few committees, also working with infection control. So yeah, that's looks like a busy day. Yeah, it's a busy day usually.
Sir, you have been in pharmacology field for so many years. So, what opportunities for MD pharmacology graduates exist today that were absent a decade ago?
I think there's a lot of information which is around. Decade ago, information was very limited. People hardly knew each other. The other thing is the evolution of the pharma industry. Many jobs have come. They're not only concentrated to Bombay or Hyderabad or Bangalore. There are jobs even in Varanasi if the company wants, or in Lucknow. The jobs are in Calcutta. The jobs are in other states as well. So which are the capitals? So they have decentralized the medical affairs. There are many companies which are working online, medical writing. A lot of companies have gone online, and information and networking has increased like anything. Many conferences are happening. People know each other through the social media. Social media has become very powerful now. LinkedIn, Facebook, all people are connecting to each other. So getting a job is not a problem, which used to be probably a decade back.
Yes, sir.
And of course,
Sir,
yeah,
yes, sir.
and of
Carry on.
course, many private medical colleges have come up. So yeah, that's another thing.
Yes, sir. Sir, how has pursuing an executive program in healthcare management from IIM Calcutta added to your leadership journey?
It made me understand a lot of integrities that to be a leader, you must know about finance. I told you I'm not a great guy with mathematics. I'm trying to learn that. Said everything boils around finance. Strategy is very important. So look at a long-term strategy. So IIM Calcutta is one of the best in the world, I would say. And with me, I had fellow delegates who are pediatricians, who are oncologists. We had a lovely group, very exciting group. So I understood that whether you are an oncologist or you're a cardiothoracic surgeon or you're a pharmacologist, you are actually at the same level when it comes to leadership. So, and especially in healthcare leadership. So that made me understand that yes, I need to learn and yeah, hone my skill further. It was a great experience, wonderful experience.
Yes, sir. Sir, you have published on ethics in drug advertisements and safety concerns. How relevant are these issues in today's medical world?
Very much, very much, because unethical advertisements are totally no. Many of our colleagues work in the medical affairs team. Their main job is to stop unethical advertisement. So I think unethical advertisement in a country like India, where 30% to 40% of the healthcare is taken care of by the RMPs, or they are not complete doctors, is very dangerous, is extremely dangerous. So if we are custodians of therapeutics, we need to stop unethical promotion of drugs. That's our great responsibility.
Even we had this social media trend recently of ORSL.
Yes, and I'm glad that the doctor won finally. That
Yes.
you cannot have a very sugary ORS in the market because it might cause an osmotic diarrhea itself. Glad that she won.
Yes, exactly. Sir, what are the biggest gaps in Indian pharmacovigilance ecosystem, and how can young pharmacologists contribute to it meaningfully?
So I think the Indian pharmacovigilance system is evolving very much. I have seen it evolving, and the current leadership is doing its own bit. I'm happy that they have a digital platform, they have a number, dedicated number. And what I really believe is that there could be more incentives in terms of publishing the names of people who contributed to it and maybe giving them CME points, something like that, which will motivate not only the pharmacologists but clinicians. I think more role need to be played by the clinicians, and that is a challenge. And how do you involve the clinicians in pharmacovigilance? But I am a strong believer that in the next decade or so, it will change because we have started teaching the students about these pharmacovigilance concept, and they are doing projects also. So the scenario will rapidly evolve.
Yes, sir. Even we have this National Pharmacovigilance Week every year. So
Yeah,
I'm pretty sure these things are creating awareness even among MBBS students
yeah,
right
that
now.
is very important. That is extremely important. Was not there maybe 15 years back.
Yes, sir. Sir, for MD residents looking to enter in pharmacovigilance, medical affairs, or industry, what practical advice would you give?
And also keep up with whatever is the most updated information, and do your thesis very, very seriously. Don't put water in it. Pani mat dalo. And if you're lucky, if your thesis wins a national award, then your interviews on.
Yes. Sir, what characteristics differentiates a great pharmacologist from a good one?
That's a difficult one. I think if you have the ability to inspire, that differentiates a great person from from an ordinary person, and the effort to do some extra, because it's only one life. If you could inspire people, if one of the person comes up to you and says, you know what, I want to be like you, because there have been instances in conferences, and there have been instances where I have traveled across India, where people have come up and they've taken selfies and they said, maybe someday I want to be like you. So I don't say I'm a great pharmacologist, but I can definitely say that I'm a pharmacologist worthwhile.
Sir, you are a great pharmacologist. There's no question about it.
I'm still evolving. I'm still work in progress.
Sir, what would you describe as the turning point in your professional life?
I would say my biggest mistake of not taking DMR.
If you could redesign the pharmacology curriculum in India, what changes would you make?
They've already made it through CBME. I will only first say name the subject medical pharmacology and therapeutics. It's not pharmacology, it is medical pharmacology and therapeutics. Put a MD guy into the industry, even if he doesn't like, for 6 months or 3 months. Do two clinical trials as a sub investigator for these 3 years. And definitely, very, very important is explore territories like medical writing. So, publication is there, but at least see how the industry functions in medical writing. And yeah, AI. There has to be a module on AI if that is possible, at least in drug discovery. That needs to come in.
Okay. Sir, moving on to our last segment, rapid fire round. Clinical or non-clinical?
Depends on what you want. Can't be.
In your choice.
Well, I'll go for a paraclinical.
Okay, right. One skill every MD pharmacology resident must master in 2025.
AI.
Industry or academia, where is the future brighter?
I think it is brighter both ways, depends on what your liking is. So I never say that one is better than the other. It is something like, do you like Hrithik Roshan or do you like Nana Patekar? Both of them are extraordinary in their own class. What is the movie type you are trying to watch? So both of them can give you the sky is the limit. Depends on what kind of human being you are. It's very important for each one of us to understand what you like. Many of us are still confused on what we like.
One course every doctor should do.
Management.
Very myth about pharmacology you want to break.
That we don't take any initiatives. We are very, receptive kind of people. We are very pro people. I want to show the world. We are very proactive people.
Sir, your favorite role, clinical, researcher, educator, or leader?
I'm a very greedy person. I'll take everything but lead it.
One mistake young doctors commonly make.
Is think that any experience, only experience which they're looking for will count. No, every experience counts. Whether it's in gynae or it is in radiology or it is in pediatrics or it is in anatomy, every experience makes you the person you are. So never ignore any experience which comes your way.
Yes, sir. If not a pharmacologist, what would you be?
Difficult question again. Maybe I would have tried my luck in the media. Yeah, a little bit writing or maybe in front of the screen.
Yes, sir. Sir, one book or resource that has shaped you.
I really like one book which is the Daily Stoic by Ryan Holiday. It picks up a topic every day and gives you a gyan, and some of it I believe, some of it I don't believe, but it is a nice book to read every day.
Sir, your message to next generation of pharmacologists.
Say that believe in yourself, believe in your subject, and make the best of whatever you do, because there's always a dearth of a good pharmacologist anywhere in the world. Trust
That's it, sir. Thank you for your time, sir. This has been a wonderful session. I'm sure जो भी सुनेगा ये session को, they will learn a lot. They'll have a lot to take from this session.
Hopefully, I mean, this is, so I say, I cannot be stereotyped. So you have people who could be stereotyped. I could not, I've still been stereotyped a little bit. But yeah, I always call myself as the small mountainous waterfall which is making its own way. So honestly, if you would have asked me in 2009 when I finished my MDs, what do you want to do? What I would have said and what I'm saying today is totally different. But this journey has been very exciting, very, very fulfilling. And, I would say that yes, I really thank my subject. My subject has given me what lot, and as I mentioned, I'm very indebted to my subject.
That is really great, sir. Thank you so much, sir. Thank you.
Thank you, and do the great work, Pranav.
So, this has been an incredibly insightful conversation. Professor Dr. Subhrojyoti Bhowmick's journey from MBBS to MD Pharmacology, from industry to global research, from hospital leadership to digital health, and now shaping academic excellence at KPC is truly inspiring. If this episode has inspired you, do share it with your friends, colleagues, or anyone exploring career in MD Pharmacology or medical leadership. I'm Dr. Pranav Joshi signing off. Until next time, stay curious, stay inspired, and keep decoding medicine.